Welcome back to Toledo Clinic TV. My guest right now is Dr. Moshir Jacob, and he's here to talk about the toxicity of smoking. We all know we should quit smoking or not start smoking to begin with.
Correct.
Why is it so dangerous?
You know, smoking, everybody's talking about it, and, you know, most of the smokers, they are aware that it's bad, but we need to know that this is really serious. Smoking is the main reason for preventable death in this country. It's responsible for over 440,000 deaths in the country. So it is really serious, and it's been known that if you quit smoking, your health will start to improve immediately after quitting.
What about the risk of secondhand smoke? Children who grow up in a home where a parent smokes, for instance.
Yeah, I think this has been an issue and it's been discussed. We don't know if it is, you know, secondhand smoking, if it is really serious or not. And this has been settled. Secondhand smoking is serious. It's not as serious as firsthand smoking, but it is. So if you really have somebody in the household, your kids, your relatives, your family, they are actually affected by the secondhand smoking. And it is known to be one of the reasons of at least 40,000 deaths per year.
Marijuana smoking is becoming legal in many states, also very dangerous.
Right. I kind of seeing that happening all over the country, but smoking marijuana carries the same risk of the cigarettes. Marijuana have the same toxin, the same carcinogens, the same effects as smoking exactly. And in addition, of course, to the addictive pattern of that.
And cigars?
Cigars, you know, maybe even worse. I mean, a lot of my patients telling me, you know what, doc, I don't smoke, but I have a cigar every now and then. It actually carries much higher risk of mouth cancer than smoking, but it's the same carcinogens that's present in cigarettes also in cigars.
And you talked about the toxicity of cigarettes or cigars. What are the chemicals that are causing so many problems for people?
Yeah, you would be amazed to know there's at least 70 carcinogens or chemicals that is present every cigarette we smoke. I mean, everybody knows about nicotine and tar. Tar, it's the same one that we pay in the streets. It's in the cigarettes, but all there is the ammonia, which is it's a cleaner. If you check on the cleaner that you have in your house, you will find ammonia as part of it, and this is one of it. Acetic acid, again, arsenic. Arsenic is, we use it as a rat poisoning, and it is present in the smoking. There's a lot of others, but just to mention a few, there's at least 69 to 72 carcinogens in every cigarette you smoke.
And you say there are really four main reasons that a person should quit smoking.
Yeah, I like to breathe that into four. If you look at your health, that is one. Your wallet is two. Convenience, three. And your family is four. So if you look at your health, I mean, it's the Surgeon General said clearly, if you really want to do one thing to improve your longevity and health, is to quit smoking today. And your wallet, and I always tell my patient that. I mean, the pack of cigarettes here in Ohio costs about $6, $7 a pack. And most of the smokers between one pack and 1.5. So we're talking about $8, $9, $10 per day. This is equivalent to a new car. You can lease. I tell my patients always, you can lease a new car with this, you know, money that you're wasting every day. This is like what, $3,500 dollars every year. So your wallet you're going to save a lot of money when you quit. Now, convenience. We see now a lot of bars, restaurants, a lot of places you can't smoke in there. So it's every time you have to go outside in the cool, in the winter, you know, it's snowing today, and then you have to go out the building to smoke. I mean, do you really need to do that? And the fourth element is the family. If you really care about your family, if you have kids, nephews, you know, family members, as we said, secondhand smoking is really, really serious. So you need to quit, not just for you, but for them.
So the bottom line, quit or don't start smoking to begin with.
Yeah, that's no question. That's actually the best thing to do. And it's well known. If you think you can't quit now, or you may quit later, but every quitter, everybody who quits actually have tried multiple times before they quit. So you really need to think seriously and start the first step.
Okay, thank you so much.
You're welcome.
We'll be back in just a moment.